Hey everyone, this is Priyanka Patel, and I'll be talking about staffing nurses to patient ratio, a professional development presentation. Let's have a quick look at the video. The purpose of this presentation is to discuss how current staffing impacts on patient safety. It covers how effective leadership can have positive impact on patient safety and healthy workplace. This presentation will cover the following topic: current situation, effective leadership and problem resolution, clinical leadership expectations on a graduate nurse, purpose of this form of communication. Current situation, the importance of patient safety. Patient safety is essential in today's healthcare system and nursing. Different types of non-deliberate harm caused by nurses to patients via different clinical management and communicational errors. It is necessary to ensure patient safety and enhance quality care to the patient. One of those influential factors is nurses to patient ratio. The importance of healthy workplace. Registered nurses have high potential to lead workplace safe. Maintaining safe workplace does not only reflect on patient welfare but enhance positivity in the ward. Registered nurse values work with co-worker and creates culturally safe work. The detection of errors, support communication, and teamwork creates safe environment. Current situation. The primary responsibility of nurse is to advocate patient safety and quality care. As a registered nurse, patient safety in general is achieved by lower rate of falls, infection control, minimize medication error, and avoid uncertain death. Therefore, it has been recognized that safe staffing has huge positive impact on quality care and safety of the patient. According to New South Wales recommended minimum ratio of nurses to patient in hospital and ambulatory unit is 1:6 in medical surgical wards, 1:4 on critical non emergency rooms, 1:2 for trauma and post anesthetic wards, and 1:1 for patient under anesthesia. However, in rural and regional areas, nurses-patient ratio increases up to 1:11. Furthermore, the uneven distribution of staff, extended long hours of work, and rotating shift works are directly associated with other healthcare worker concern factors like fatigue, burnout, and sleep deprivation. The systematic review suggests that working with high patient load and longer than scheduled hours, nurses have difficulty in handling the care responsibilities. The nurses are reluctant to return calls to the doctor and follow up their care needs. The high nurses patient ratio and consequence of incidents, for instance, high stress, fatigue, and exertion, increases in errors, impaired problem solving skills, and burnout. Longer hours do not always allow break in between the shifts, which increases sharp and neurostech injuries. Nevertheless, it also increases the risk of musculoskeletal injuries. Consequently, patient care needs gets compromised and hampers overall health and well-being of the patient. Significance. The inadequate staffing ratio along with high patient acuity level, different unforeseen circumstances like trauma can cause exacerbation of emotional distress and exertion on the nurse. The nurse may experience burnout, which increases the risk of occupational injuries. Extended shift raises high concern to both patient and nurses. As a nurse working longer shifts and extra hours, there are no rules and restrictions on the working hours of the nurses, which challenges safety of the patient. According to research, more than 37% of clinical errors and more than five times diagnostic errors was occur when nursing staffing was short, among which medication error and procedural errors poses high risk factor to the patient. Furthermore, critical healthcare worker workload gets uneven time pressures, which leaves nurse no time to double check and causes significant harm to the patient. Therefore, low staffing increases mortality rate of the patient. Effective leadership and problem resolution. Initiating action. Different strategies can be implemented to combat nurse-patient ratio and prevent associated adverse outcome. According to Safe Patient Act, safety is ensured by improvement on existing nurse-patient ratio and by creating different range of clinical settings. Rounding method can be introduced in the ward as per Safe Patient Care Amendment Act. Rounding method is accepted if expected number of patient or the bed on the ward is not divisible in whole number. The hospital or ward must ensure one additional nurse to comply with the ratio. Coordinating. As a result, coordinating within relation to workload and fatigue, the Accredited Council for Graduate Medical Council can rule for employers to provide work schedule which provides information about rest and educate staffing to promote healthy workplace rotation shift and reduce excessive overtime. The evidence-based study suggested feasibility of short 8 hours of work and eradicating 12 hours shift to reduce fatigue, work-related injuries, or burnout. As a leader, one should ensure safety of all the registered nurses working on the health ward and well-being mentally and physically. Effective skill mix and proper task delegation can be implemented on the ward, motivating, providing guidance and confidence. As a leader can motivate staff by different rewards and appreciation. Staff who are motivated performs work better. A leader also provides guidance on the roles, how staff are working effectively and efficiently. Providing guidance increases confidence and acts as a bridge to the staff. Staff can always raise a concern regarding any issues. Building positive work environment. A leader can listen to positive and negative feedbacks, concern, and ideas by the staff or to solve problems. A strong leader should also treat all the staff with mutual respect and set positive example how staff can treat each other and the patient. Clinical leadership expectation, a new graduate nurse. Australian Future Health Workplace identifies increasing and aging population with complex and chronic illness, high acuity levels, and morbidities of patients. The demand of registered nurses has increased tremendously by 7.5. Therefore, the ratio should be considered strongly and actioned appropriately. Laterally, there is also a gap of future supply of registered nurses and demand on health workflows. By 2030, the supply of registered nurses will be lower as per demand. Health Workforce Australia initiates a program to prevent nurses shortfall, which includes building leadership capacity, improving practice as a registered nurse in early career preparation by support, supervision, and opportunities. Lastly, improving productivity of new graduate nurse and changing existing skill mix to illustrative skill mix. Graduate attributes, duty of care. Transition to practice may be challenging and emotionally overwhelming, but as a new graduate nurse, I'm legally obliged by duty of care towards my patient. My primary duty is to provide patient-centered care in a holistic manner. Task delegation. As per registered nurse standard of practice 6, I will prioritize my care and delegate tasks appropriately to enrolled nurse and student in both clinical and non-clinical role within a scope of practice. Likewise, I will effectively supervise delegated tasks is safe and under scope of practice. I will effectively use appropriate process to identify actual risk, report potential problem where practice is below standard. Communication is a core value in nursing practice. I will communicate effectively to entire nursing team and ask for any help that I need without any hesitation. If any unsafe practice is seen due to staffing, I will escalate it to senior supervisor. According to the Code of Nurses Principle 1, legal compliance, and Principle 2, person-centered practice, I will practice legally, safely, and collaboratively and promote shared decision making. Overall, ensuring patient is safe is the key priority. Purpose of this form of communication, aim of delivery. This video critically reflects on contemporary situation of all the registered nurses. It discusses about other professional and personal factor that arises the issue in short amount of time. The purpose of this video is to gain two-way communication and receive feedback to improve for future response. The use of this method of communication is to be precise, informative, and yet make a relevant discussion. The uses of narration along with PowerPoint presentation to elaborate this issue precisely. Targeted audience. This presentation is targeted across different range of healthcare organization with anyone interested or involved in patient safety. It includes wide range of audience, for instance, human resource, risk manager, safety manager, patient safety staff. This presentation is aimed to deliver knowledge and in service to nurses, unit manager, clinical nurse educator, registered nurse, enrolled nurse, and student nurse. Here's the reference list. If you have any question, feel free to ask me. Thank you.